Hi Julie, I'm Deborah from Empowered to Birth. I'm another one of your Hypnobirthing Australia practitioner colleagues, and welcome to the group. I'm sure you'll find that there's a lot of helpful hints here from some of the other practitioners as well. Now, you did ask about the props that we use to help demonstrate the process of labour and birth with our clients, and a lot of the other girls have already explained to you that they've got the doll and the pelvis, which I have too, and I just wanted to show you what I do with the doll and pelvis. So you will be using the pelvis to demonstrate the process of the second stage of labour where the baby gets out, but I just wanted to show you the adaptations I've made from the regular doll with its umbilical cord and its placenta, because what we find is when we're demonstrating things to our clients, they're taking that on board as visually being fairly correct, and I find that with the traditional doll and cord and placenta, when we undo the press stud at the belly button, our clients often think that that's what happens in the third stage of labour. So I've made a few little changes to make it a little bit easier for us to explain something that's a little bit more anatomically correct to our clients. Firstly, I've put a membrane on my placenta so that I can show how a baby is in a sterile sac and it's surrounded by fluid. I can also explain the difference between when the membranes release in front of the baby, you can get a big gush of fluid out from the front. But sometimes the membrane might release at the back, what we call the hindwater leg, and then there's just a little gush of fluid or a little trickle of fluid by the time it comes out the vagina. So women might just have constantly wet knickers, not this big gush of fluid. So that's really important when you're talking about things to get checked out by your midwife or your doctor. But what I really wanted to show you, I'm really quite excited about this change that I've made to the doll, is that after the baby's born, the placenta's still inside mum, baby's out, and at some point the cord is clamped and cut. Now, whether you talk about delayed cord clamping, that's another story, and I think that's very important to talk about that. But I just want to talk about the clamping and cutting of the cord. So the two metal clamps are put on in the middle of the cord, and then the partner is offered the opportunity to cut the cord. So I use plastic clothes pegs to demonstrate where the cord is clamped, and then I just separate that, and I've put a couple of magnets there that will hold that together. So separate the cord in the middle, and what we're left with is a baby then that is attached to probably about 30 centimetres of cord, and baby is skin to skin with mum, having that lovely time, that pro-nurturance time, that access to the breasts for breastfeeding, and that's really important. And a little bit down the track, when it's convenient, the midwife will place another little clamp. Now I've got the proper clamp from the hospital, which is what would be used on the baby, but I don't use that because once that is clamped shut like this, it doesn't undo, so it can mess my doll up if I use this. So I show the clients this, but what I use is something that looks a little bit like it, and it's a clothes peg, and it's easy to open and close. So come here, babe. So I put this other little clamp on closer to the baby, right near their tummy, like it would happen in the hospital, and then we make that extra cut in the cord here. So what we're left with is a little bit more anatomically correct looking doll at this stage. So the baby's got about 3 or 4 centimetres of cord attached to its tummy, and it's got the plastic clamp on, and I can explain to the clients how that stays on for about 7 to 10 days while that cord dries out and drops off. And then I can also show that when that drops off, the baby is then left with its belly button. So I hope you've liked this way that I've adapted the doll and pelvis, and I'm quite happy if you want to copy what I've done and share that with your clients. If you want to share the video around with some of your friends, that's okay too. So I look forward to meeting you, Julie, at the conference later this year, and welcome to Hypnobirthing Australia. It's great to have more practitioners on board.